Hey everyone, welcome to another episode of Darshan Talks. I'm your host, Darshan Kulkarni. It's my mission to help patients trust the products they depend on. I'm an attorney, I'm a pharmacist, and I advise companies with FDA-regulated products. So if you have an interest in an FDA-regulated company or their products, this is the podcast for you. So today's podcast is going to be about podcasts. It's going to be about promotional compliance. It's going to be about a variety of issues, including, I'm thinking, and I don't know yet, whether we'll get into First Amendment right issues. So if you are you're in the promotional compliance field, so whether you're a marketer, whether you are in medical affairs, whether you are in a regulatory affairs, legal, looking at promotional compliance, this is the conversation you want to listen to. So today's guest is the president of Philly Cook Consulting, which helps companies communicate about FDA-regulated products using 21st century tools while remaining compliant with the regulations written in the 1960s. So for those of you who don't know, it's basically him pointing out that we are using antiquated laws to regulate 21st century issues. So our guest for today, Dale Cook. Thanks for coming on, Dale.
Thank you, Darshan. Great being here.
Great having you. So we've had a little bit of...
I don't automatically leap to antiquated, right? Like,
no?
Antiquated is such a loaded term that implies that, I mean, at a bare minimum, the regulations were not written with today's technology in mind. Whether they are sufficient for today's technology, I don't think they are, but that's yeah. Anyway,
here's the problem, Dale. What I'm saying is, I believe in clickbait, and if you don't use the horse and buggy analogy,
yeah, okay, yeah,
okay. So let's talk about some of the issues that are popping up, and it's funny. We had a little bit of conversation right before we started, and it's funny, we're starting to see a lot of the same issues pop up for each other. So let's start with the first one. Let's say you're doing a podcast and a CEO pops up and he wants to talk to you and he thinks that he can talk about his product. Comes on, discusses it. Let's assume that the CEO is generous about his claims. He truly believes in his product. He's always been a supporter of them. He's going to be talking about them not just in the context of what's been approved, but really the type of research they're doing, how they're making forward-looking statements, if you will. What is your take? What kind of feedback have you gotten recently around that? Whether it's podcasting, whether it's radio, whether it's TV, just interviews of all kind.
Yeah. I mean, this is a really hard topic, and we don't have clear guidance from the agency on some of these matters. I mean, some of the things that are going on, just recently in some of the recent FDA enforcement actions, I think the agency is coming out pretty clearly to say, some of these interviews and appearances that are promotional in nature qualify as being promotional labeling. I mean, for both the Paragard instance and the Khloe Kardashian recent enforcement from OPDP, one of the items, I believe in both letters that was cited, was failure to submit under cover of Form 2253. Mm-hmm. And of course, why would you submit it under cover of Form 2253? Well, you would do so because it is, promotional labeling. And so you don't submit material that doesn't qualify as being promotional labeling. So if your position as a company is this material does not qualify as promotional labeling, then you're not going to submit it, right? That's the one way, if you submit it down to the agency, you are saying this is promotional labeling, right? And you're, by voluntarily doing that, you then are setting yourself up to say, I've got to, meet all of the requirements associated with promotional labeling. So that's a challenge, right, for these types of scenarios, right? If we're live streaming this and I'm the CEO of my company and I start making claims about this, FDA in other circumstances has said that sometimes these sorts of interviews have to be submitted. So, that's sort of the first issue, and the first hurdle is, are they in fact qualifying as promotional labeling? FDA in these recent actions is saying some of these paid sponsored influencers who are talking on behalf of your product in these venues and forums that sort of blur the lines between paid promotion and sort of native advertising. When somebody goes on the Tonight Show, do I have to, and they've been endorsed, do I have to then submit that down under cover of Form 2253, the Jimmy Fallon interview? Obviously, FDA thinks so in some circumstances.
Well, let's rephrase the question. Why shouldn't it be submitted as part of as promotional labeling? And the reason I asked that question is you went on there to promote your product or your or the fact that you work at the company. You're representing the company. Why shouldn't it be promotional?
Well, I mean, there are tons of promotion that doesn't qualify as promotional labeling, right? We don't submit every sales call, right? When a sales rep walks into the physician's office, we don't require the rep to go ahead and create a recording and then submit that recording down to the FDA, right? That doesn't qualify as being promotional labeling. And so there are tons of instances of that sort that don't qualify. And if the person, especially when it can become really gray, if the person is not primarily being interviewed or their appearance is not solely about the product, right? If I'm talking about my company and all of the things that the company is doing, and perhaps I'm talking about my personal story or my personal journey or something of that sort, and then a momentary exchange in a longer interview talks about a product, does that qualify or not? I think at a bare minimum, that's a hard question, right? And you get into these, what was the intent behind engaging in the interview? What were you trying to do? These are not easy issues.
So that really raises the question of, is the FDA really going to enforce questionable behavior? My experience is generally the FDA will enforce questionable behavior in two primary areas. One is it wasn't that questionable. Two is, and maybe three. Two is the fact that they want to make a point and they want others to learn from that experience. Yeah. And three maybe is the fact that they've made a claim, they put something out there, your behavior may be questionable, but it probably falls under the ambit of something they've already opined on. But what's your take? Do you think that? So I'm sort of saying is podcasts necessarily or an interview on Jimmy Fallon or whatever it is that you're going to do, is that really so different from you running your own interview? Is the lack of agency or control, if you will, the determining factor?
Well, in general, I think, yeah, the lack of control is a determining factor for the agency, right? I mean, if you go back, we don't have an explicit guidance on this topic, but if you go back and look at the, interactive promotional materials guidance and how you handle the 2253 filing, FDA said there, that there were three factors to consider. First being whether you have complete control, it's 100% wholly owned by you. Then you have a 2253 filing. Next up would be, where you have tremendous influence over it. And then the third circumstance being where it's an agent of the company acting on behalf of the company. And I think this falls into that, agent of the company acting on behalf of the company. And it's particularly hard for executives. And I want to, when I train companies about this, I talk about the executive dilemma that, the executives, the CEO, et cetera, spend so much of their time talking to investors. Right. And they spend so much of their time in those conversations where the rules are just different, right? I'm not aware of any formal FDA policy saying we don't treat investor communications as being, promotional labeling. I do know, though, that you cannot abide by your promotional labeling requirements, in particular the requirement not to promote off-label, while also abiding by your SEC requirements to keep your investors informed about future developments for your company, right? It's literally impossible to do that, right? If I'm talking to my investors and I'm investigating a new drug and that's going to bring in a significant source of revenue, I must disclose that. There's to my mind, that's an obvious point that's materially relevant information that I have to provide per the SEC to my investors. And so then if you're a CEO or another executive who is used to having those types of conversations where you must provide that type of information, and then suddenly you're in a setting where, the classic example being the CNBC enforcement action from several years ago against the CEO of Agerian, who, on CNBC was considered by the agency to be engaging in, inappropriate promotional activity. I mean, that was people sat up and took notice, right, of that enforcement action, because boy, that sure looks like you're talking to investors, right? Now, the specific statements that he made, I think, pretty clearly went over the line in terms of, suggesting that the product was in fact safe and effective prior to its approval. He said the product would keep people alive. He said people who otherwise would die before age 20 would be alive to see their grandkids, right? That's suggesting the product is effective. I don't think there's any question about that. But again, if I'm talking to investors and I'm talking about why we're so excited about the product and think the product is going to have, such a significant revenue potential, then those types of statements might be, even if they're not required, they might certainly be acceptable to explain to investors why you think the product has such tremendous upside, right?
But I think that's one of those conversations where you can go, does it meet the standard of truthful and not mislabeled? And you could argue, well, maybe the FDA needs to have a discussion about what that sentence means. Mm-hmm. And if they can explain what truthful and not mislabeled means, maybe it contextually starts making sense. So, for example, in scientific exchange, maybe that standard has a different meaning than in SEC discussions, which has a different meaning. And they've done that, let's be honest. I mean, with FDAMA 114, they've had a different expectation using the CAR standard compared to using substantial evidence. So we've had that, what the FDA will consider as acceptable versus non-acceptable. And maybe that's the direction they need to consider. But I think that's your point, which is he went farther than he had evidence to allow for. And that's where the problem lay.
Well, I mean, he was talking about the drug prior to approval, so, I mean, part of the question is, would he have been able to make those statements after approval?
Right.
And would they have still been deemed to be false and misleading even after the drug was approved? I don't know. I'd have to go back and take a look at it again. Yeah. I mean, that wasn't the issue the FDA enforced on, so it's not one that I really investigated at the time or spent much time on. But certainly the nowadays, I think especially post the consistency with FDA labeling guidance, where we've seen a different standard being applied, the agency making explicit what its standard is for those statements that are not directly attributable to the label. It's hard, right? It's not an easy, analysis. So yeah, these are hard questions. I mean, this is why we have a job, right?
I agree.
Yeah.
So let's talk a little bit more about consistency. We talked about podcasts, but one of the reasons we're seeing things pop up in a more interesting manner is a lot of the FDA's hesitancy around tobacco promotional enforcement. And what you had in those scenarios was and this is something the FTC looked at as well. The idea being that they used influencers, and in those cases it was, I believe it was Juul, if I remember correctly, but one of the nicotine replacement therapies coming out and basically influencing kids to use it. And the FDA cracked down on it, FTC cracked down on it. But now I think we're starting to see the emergence of that same culture in pharma and med device. Have you seen an uptick in that? And what do you think is going to be determinative? I mean, I'll sort of put my piece out there, which I think it again comes back to agency and how much control you have over the speaker. But how much control do you really have over an influencer? I mean, maybe with Khloe Kardashian, you have some level of influence, but how much does that apply to, I don't know, a 22-year-old or a 24-year-old?
Yeah, I actually kind of think that, the Khloe Kardashian might be more difficult to control. I mean, no disrespect to Ms. Kardashian. What I mean is, she is, you're dealing with a not just a person, but you're dealing with, an organization, right? I mean, she's an entity, and she's got ways of doing things. And
doing business as Khloe Kardashian, DBA.
Yeah, and so that is an entire enterprise, and that enterprise is going down the track, and it does a certain thing, and you sometimes just get caught up in it. With the 22-year-old, you might have some difficulty reining them in, but you can, at the end of the day, if you're writing a check, you have some influence. I doubt that any check that Ms. Kardashian receives is wholly going to determine her financial future.
But but that's exactly right? If you do not have that level of control,
mm-hmm.
do you as the FDA get to say, you pharma company X should have more control over these people? Because Khloe Kardashian, in her own personal viewpoint, is allowed to say almost anything she wants. That's a First Amendment right issue. It's the fact that she's saying this on behalf of a company that causes the problems. So if that's true, how much agency does what you just pointed out is exactly the point. She has complete agency over her own actions. No pharma company can really tell her what to say.
Well, I mean, yes and no, right? If we sign a contract, right? If we sign a contract according to which I'm going to pay you X dollars, and in return for paying you X dollars, you're going to make certain statements, then I absolutely can include a provision in that contract that says you're only going to make the statements that I tell you can make, right? And you're not going to talk about this product outside of those settings. And so it's purely contractual matter. And I think that, if you want, and that's also where sometimes you wind up with these questions of, faux influencers who I'm finding more and more, especially on Instagram, where they are clearly trying to break into the influencer marketplace, and they're posting things that are clearly mirroring the paid influencers. In some cases, like in the pharmaceutical arena, they're literally taking the exact words, including ISI and links to the PI and those types of call outs. And I look at it and it's a client of mine, and I'm like, I don't know who this person is. Like, why is this person? And it's like, oh, this is what's going on. This person is not actually contractually related to me, but they're trying to make it look like they are, so that then some other person is going to think, oh, well, if they were hired by this big pharmaceutical company, then obviously they must be a reputable influencer. I'll hire them to promote my, product. And so these get tricky, right? But again, that person doing that, I might be able to say to them, please stop, right? I certainly will not, necessarily, be upset with them. But I'm also, if they're going off script, if they're doing things I don't want to, then one of the questions you have is maybe you just stay away from it, right? Maybe you're better off just leaving them alone and let them do their thing if they're not hurting your brand. If they're
What if they're helping your brand though? What if they're
what if they
actually
are helping your brand? Hey,
no, let's say that they start making off-label sort of
sure.
claims about your product, and that's not hurting you, but
Well, it
lands up
depends,
helping you,
right? I mean, maybe it's
right?
hurting you, maybe it depends. Maybe it's
Right.
hurting you, maybe
Absolutely.
it's not. Let's assume for the hypothetical that they're not hurting you.
Yeah.
You know, the intended use rule, right? Let's go September, right? The new modification, deleting the knowledge sentence and deleting the knowledge sentence saying, currently the regulation states that, knowledge of the intended use is potentially something that can be used as a factor showing what you, the manufacturer, intended. So if we don't know what's going to happen with that, right? They've been trying to modify the intended use regulation. It feels like they've been trying to modify it for the past 50 years. It's actually this most recent thing is only about the past 6 years, 2015 to today. If that goes through, that would be a tremendous weight off of pharma's mind, right? That they could not be held accountable solely based on the knowledge. But if you start doing other things,
I'm gonna challenge you on that, because that guide, in that specific instance, they said the knowledge requirement really applies to engagement with physicians. This is actually with patients.
well, yeah, but this is just the intended use regulation is just talking about knowledge per se, right? And doesn't distinguish. So I think where you're going to is, where was that distinction? I think that was in the CFL guidance where they were talking exclusively about presentations to physicians and not consumers. Is that what you're?
Well, I think there was a component in the intended use guidance that actually talks
Okay.
about engaging with patients as well. They actually talk about it in the context of lay summaries, which I think is a different discussion that's worth discussing, just not right this second.
Right.
But I kind of was also playing devil's advocate just to give the listeners something else to listen to. By the way, we have a comment coming in. I can't tell who it is, and I'm going to respond to it, but I'd love your response. LinkedIn user: couldn't FDA go after the media company to pull these references from non-contracted influencers? And my answer is no, because assuming he's talking about the media company as the media company for the pharma company, not the media company as in Twitter, because FDA has no jurisdiction over Twitter. And if the media company who represents the pharma company, well, if a media company who represents a pharma company came to me as a non-contracted influencer and told me to stop something, I'd go, why? Who are you to tell me what I can say and what and cannot say?
Yeah.
Unless you're making a copyright type claim or a trademark type claim. But there's no the FDA shouldn't have the authority to do that, even though I get the reasoning behind it. But what's your take on it?
Yeah, I mean, to my mind, that's a pretty clear First Amendment,
Right.
question, and the government just can't tell people what they can say, right?
Exactly.
If you are subjected to FDA regulation, if you go into the business of being a pharmaceutical company, then you give up a lot of your First Amendment rights by virtue of doing so. And I think we're all, we accept that as the price of doing business.
So thank you again for whoever that was with asking that question. So let's delve into another sort of topic that's popping up, and we saw this right before we went into COVID, which was the FDA was starting to go after events and looking at comments and conversations had during these conferences, if you will, so exhibit halls and the like. With COVID, we've now switched over to more of a virtual model. Are you seeing any conversations or any buzz around virtual poster presentations? And
certainly a year ago, right, as we're having this discussion 1 year ago, when all of a sudden the light switch was flipped and all of these events, right, you and I were scheduled to be in DC together, right, and the conference got canceled, the the day before we were leaving, I think, was
Yeah,
when
I still didn't get my money back from Airbnb, but that's beside the point.
okay, well, yeah, separate issue. So that whole thing, right, happening right then, everybody was asking me, like, okay, everything changes, and the answer there are some, that's one of those scenarios where some of it is same old, and some of it is you have some new considerations. One of the most significant ones being one, you have no real control over who is attending and who's appearing at these events. In a physical booth setting, I can, identify the person who comes in, and I can ask you questions about, for example, where are you licensed to practice? Are you a United States physician? Are you, licensed somewhere in this country? Or are you from Canada? Or, from some other marketplace? And then I can start identifying issues. When your LinkedIn user who's commenting on the poster and you choose not to identify yourself, I don't know who you are. And so I need to be very cautious because, of course, in our arena, what I can say to you depends in part on who you are and where the product is, right? And the product might not be approved in your particular arena. Second issue is, these things, I just earlier today was recording video on my screen for some sample ads that I'm going to use in future presentations. And I do that all of the time, just recording video off of my computer screen. I have no idea whether any of your viewers, listeners are currently recording this conversation or not. And as far as I'm aware, there's no way that I could prevent them from doing it. Right? Like, if they wanted to, they could be. And then all of a sudden I got a thing that's out there that I might have not intended to be a standalone presentation and to fully meet all of my obligations and yada, yada, yada. And now that thing is getting distributed, right? And especially if they start making changes to it. But even if they don't, in a real-time conversation, you can do things that you wouldn't do if it were intended as a standalone, right? So,
thank you. No, those are great comments to sort of think through as I think your takeaway, correct me if I'm wrong, is unintended consequences.
Yeah. And especially when, as it happened then, it was, a light switch being flipped. And it was just like, I just didn't think about that. Right. I mean, because you got to think through these things. And, and I get the pressure on, the reviewers and the marketing teams to get the materials out the door. And as I said, we literally were going somewhere the next day. So what I'm going to tell people, no, you have to change your marketing budget completely because I need time to think. Really? Okay.
So let's ask one more question before we shut it down, because like you and I discussed, we could keep doing this for hours. The last two, I believe, warnings that came out, I'm not sure if they're title letters, untitled letters, or warning letters, but the last two were resulting from the bad ad program. Mm-hmm. I remember when the FDA announced the bad ad program.
10 years old.
Has it been 10 years?
It's 10 years. Yeah, the 10-year anniversary was last year. You didn't get your invite to the party?
I'm so counterculture, they don't invite me to parties.
Yeah, no, I wasn't invited either, but I'm sure it was a blast.
But you're cool. So my question is, are you seeing an uptick, or is this just, well, I can't really go to meetings or anything like that, so might as well start going through the old pile and seeing what pops up?
Oh no, I think bad ad changed the game for industry really significantly, and I think that physicians are absolutely taking FDA up on it. But it's not only physicians, it's other people who are aware of these things. FDA is doing a good job promoting the program, and the program is working from their perspective. Right? They are proud of it.
But let's flip that around. What qualifies them to even have an opinion? I mean, it's...
Well, yeah. I mean, the FDA does do, they now offer CME credit for going through a mini training course, which it is a mini training course. And note, you don't get instant enforcement action, right? FDA gets thousands of these bad ad complaints, and they, as you said, two. I don't think the third letter this year was from bad ad. Might have been. I don't remember. So two of the three this year, so FDA still has to go through that process. But if you think of the 100,000 pieces that OPDP receives every year, the idea of getting assistants to help them identify which ones they want to actually look at and target and investigate further is probably extremely valuable, right?
What would be useful, and I really wish the FDA would give us more trending data on this. How do they decide what they want to go after? Like you and I had a discussion offline where we talked about, well, I think they're often trying to make a point, and this might be the way they do it, and they don't want to put out a full guidance or anything on it, so they'll just use an enforcement action to make their point. But it would be useful to understand from an enforcement priority perspective, what are they looking at and what are they considering?
Right.
And while the FDA does expect industry to engage in as much transparency as possible, I really do think that the FDA can do a better job being more transparent themselves. So
I mean, they've been pretty consistent in their their public statements about taking the risk-based approach that they take to enforcement, looking at violations that put the public health at risk.
But that's pretty general. That statement of risk-based puts public at risk. No, I'm 100% with you, and I think that the FDA does as great a job as they really can. But I do think that if the goal is we think industry can do better. We think that industry should be considering these factors. We'll tell you what we think, but these are issues we're starting to consider this year. Yeah. So look out for this. It's useful for sure.
Mm-hmm. So, yeah, I mean, I do think that these two actions, going two most recent ones, for the untitled letter to Nurtec and the warning letter for Paragard, both dealing with these so-called or sort of native type placements. I think that is a sign that one, there are a lot more of these going on, right? That these are becoming more popular with pharma. They've been around forever, right? There's no question about that. And especially when you're dealing with celebrities, right? I mean, celebrity enforcement and endorsement, I have a blog post about how dangerous celebrities are, right? There's just a litany of celebrities, Magic Johnson, Cal Ripken, not just athletes, but going after, these different celebrities. Second member of the Kardashian family. The Kardashians, I do think, pose a higher level of risk. And the reason that they do, I don't mean that sarcastically, and I don't mean that's an insult to the Kardashians. It's because they're popular. And so one of the factors FDA always talks about is the reach of your messages, right? How a Super Bowl commercial is going to get greater scrutiny from the FDA because it has bigger reach. And so if you go with the Kardashians, they are extremely successful. They've done a very good job of getting their message out to a large group of people. I think that means inherently that you're more likely to face enforcement if you're dealing with them, just because your message is going to get bigger reach. On the other end, no insult to the doctor who was involved in the Paragard action, but the Paragard action was an OBGYN going on a morning talk show in Boston. Not quite as prominent, let's say, as Ms. Kardashian, right? I
don't think even he would object to that, but yeah.
I don't think that the physician would object to me saying that she was less had a smaller platform than Ms. Kardashian did, right? So
yeah. But let me ask you this question, because I've been struggling with this, or at least thinking about this a little bit more recently. When you're engaging with a celebrity, and I don't know if you've ever been involved in the contract negotiation associated with this, do you, at the time of the contract itself, do you think, sign up saying, if there's a problem, you sign up to do the second corrective ad for free?
I have not been involved in those contract negotiations. I'm an attorney, but that's not, the part of the celebrity contract negotiation is not something that I have done. But I would think that would certainly be something that you would want to be in there, because if you are going to get, that's what happened with Kim Kardashian,
right.
was that she put up the corrective messaging post when her Instagram post was first got the violation. 2015, was that 2015 that happened? I think it was 2015, right?
Maybe 2017. I can't remember, honestly. It was
Right.
Instagram. I don't even know. Whatever. The point being, though, the moment you do that, aren't you officially winking to the FDA and winking to Chloe or Kim that, look, we'll do the first one wrong because we'll get double the advertisement?
Oh, I don't think so at all. I mean, this was absolutely a topic of conversation around the Kim Kardashian.
Yeah.
Her enforcement action was the company actually, happy to get the letter? And I do not have any inside information about that specific situation. I cannot imagine that the company was happy about that. I mean, I don't think so, because even though you get the promotion, call me naive, I don't think companies like the FDA saying you're putting the public health at risk. And I really don't think that companies like it when you're saying you're jeopardizing the lives of, pregnant women and their unborn children. Like that's something that I just don't think you want your company to have that, mark on your company's reputation. And if you want to talk to OBGYNs and then the FDA calls you out for doing that, I just don't think that's something that a company is happy about. Maybe I am naive. Maybe it really was all a publicity stunt. I just don't believe it. But, again, no inside information. I could be wrong.
But you and I have both worked with agencies who say that my job is to push right till the very edge, not go over, but right to the very edge.
Yeah, God, I hate that. No, that's not your job. It's just not. Your job is to get the information to the people who need to have it to make better decisions about their health and well-being. And, you have to do so. That's your job, right? And doing that, it also means taking seriously the fact that the products that we're working with have risks associated with them. And part of the information that people need is, what can they expect from the product? What are the risks associated with the product, right? Benefit and risk, right? Both parts of it. And so, no, I don't think your job is to push the envelope and to go right to the edge of what the FDA is, where the FDA is. If you add one more word, now they're going to take an enforcement, but we'll delete that word. So now we're just slightly on the inside the bounds. I don't think that's the point. I think the point is, what information do the people, consumers, healthcare professionals, caregivers need? What is that information? Some of that, and what does FDA require us to do? Yeah. Sorry, I'll get down off my soapbox now.
No, I thought you were doing great. So we planned to make this about 15, 20 minutes. It's fair to say that we went a little bit over. So let's do a quick recap. We talked a little bit about marketing and podcasting. We talked a little bit about influencer ads. We talked about marketing and virtual poster presentations. We talked about risk-based enforcement. We talked about just the idea of promotional labeling. Did I miss anything?
No, well, we talked about intended use, right?
I couldn't remember if that was
First Amendment issues came up with regard to third parties, influencers and these faux influencers. Oh, this was such a rich conversation, Darshan. So much fun talking to you.
Always a pleasure. So let me ask you a question. Based on our discussion, what is one question you'd like the audience to answer for us in the comments?
The one question I'd like the audience to answer in the question. What do they think is going to happen with regard to FDA enforcement around these influencers? Do they think that this is the beginning of a trend? Are the two letters the beginning of something? Are we going to see, are we going to have not perhaps the 14 letters that were issued on search back in 2009, but are we going to see, a significant uptick in enforcement in that arena, or are these momentary blips to particularly, particular examples and not at all representative of a trend?
Speaking of trends, and I recognize that we're over time, but you remember, like, I want to say like 2005 or so, you were looking at like 198 enforcement actions. Now we consider 14 to be a lot. Do you think that we'll ever go back to 198?
No.
Why?
A few different reasons. One is I don't think I think the industry does a much better job. Seriously, I just don't think there is nearly as much violative promotion. Two, the industry pays attention to the letters. So, if you were doing something that the OPDP just dinged another company for, I think the industry responsiveness is, it doesn't take anymore the 8th letter on a topic before the industry starts to say, gee, maybe we ought to pay attention to that topic. I think 1 or 2 tends to get the response that the agency wants. So those are the 2 main things. In addition to that, I don't think the days of massive enforcement are coming back. FDA is too busy. I have other things.
We're gonna hold you to that. We'll have you back if that changes. I think we'll both be busy with that.
All crystal balls are foggy, right? None of them are crystal clear.
Fair enough. Nothing in this podcast should be construed as legal or clinical advice of any kind or regulatory advice of any kind. It is intended for educational and entertainment purposes only. For those of you who missed it, where can they find you, Dale?
phillycook.com.
There you go. And do they just go to the website there, or is there?
You can go to the website. You can reach out. You can fill out the contact form if you want to reach out to me about specific promotional needs. You can send me an email directly at dcook@phillycook.com. You can message me on LinkedIn or any other, out and about. I'm on Twitter as well.
And who are you on Twitter?
At Philly Cook.
At Philly Cook. Just before we go, we have one last comment. A lot of countries ban advertising products that are prescribed by physicians, unlike the U.S. This keeps the product costs low. I'm not sure I agree with that statement. So this is only the beginning of controls from the FDA. But I see her point. I'm not sure I agree with her point. But it's a discussion worth having. Maybe something we need to get into. I just had a conversation earlier today with a bioethicist who is brilliant, but she disagrees with me and probably potentially with you on whether advertising of pharmaceutical products is a bad idea. So I'm looking forward to actually having a conversation with her about that.
Yeah.
But for those of you who are interested, this was if you like this podcast, please leave a comment and subscribe. You can find me at Darshan Talks on Twitter, or go to our website at darshantalks.com. Thanks again, Dale.
Thank you, Darshan.